Now, as a physician who meets up with cancer patients every day, what are the problems that I face? The first problem that I face is that the number of patients with cancer is progressively increasing. And in this respect, we are specifically talking about cancers which need bone marrow transplantation as one of the curative treatments. Now, I have to say that not all blood cancers will need bone marrow transplantation to cure them. A good majority of them can be cured by conventional drugs, chemotherapy, non-chemotherapy medications. A fraction of these patients, when in a country like India, when I talk about a fraction, we are running into thousands and thousands of patients. That's primarily because as a country, we are a huge country with more than 1 billion population. We have lakhs of patients with leukemia detected every year. And all of us also understand that a lot of these diseases go unreported and underreported. That's because many of us don't even go to the hospital. The moment somebody says you have blood cancer, what do? You decide that that's the end of life. You don't even want to go to a hospital. So there is gross underreporting. And even if you say that a fraction of these patients will need a treatment like this, then we are still left with a huge unmet need. Now, when we talk of bone marrow or stem cell transplantation, what is important to understand is that there is something called as a match. You know, just like you match before your wedding, something like that needs to be done. The reason why I am saying wedding is because the level of match that you're looking at before you decide a wedding is something very similar to what they would do before deciding that you are going to match a donor and a recipient, because we are not looking at blood group matching. It's not that A group marrow can be donated to A group recipient. You have to go to a deeper level in order to look at whether there is a match or not. So, what do? When we want a transplant to be done and when we are looking at a match, the first thing that we look at is the brother or the sister of the patient, right? Because the genetic or the genes of the brother and sister are very likely to be matched with that of the patient, and hence the brother or sister can donate. What is happening now? Most parents have one child. I have only one child, right? We don't have time to make more children. So, let's say a one-child family has a disease which needs a transplant. Where do you go to? You don't have a brother, you don't have a sister to get a donor for you to take as a transplant donor. So what do? There's nothing. So you type the parents, you type the close cousins, relatives and all that, and the likelihood of match with the father and the mother and so on and so forth are very, very rare. What's happening? What other thing is happening? Today, somebody from Hyderabad gets married to somebody in the US. I'm not talking about an Indian in the US, I'm talking about a white person. Somebody from Punjab is getting married to somebody in Tamil Nadu. So what happens? There is a diverse interplay of complexity in the genes. So when there is complexity, it's even more difficult to get a match.